For everyone who's just joining us, just want to repeat that we are just waiting a few moments. We're going to get things started at 2:35, but go ahead and introduce yourself in the chat with your name, city, favorite food as well, and make sure to mute yourself to eliminate some background noise. Thank you. Okay. Hello, everyone, and welcome. Thank you for those who have entered in the chat. It's so fun to see where everyone is joining us from and your favorite food. Um, just another reminder, if you aren't speaking, make sure to go ahead and mute yourself just to eliminate background noise. And I'll go ahead and get started. So I am speaking from the physical space of New York City. I'd like to acknowledge the land on which I currently reside, which historically was that of the Lenape, Canarisi, Rockaway, and Wapinger Indigenous peoples. We deliver a land acknowledgement to acknowledge the historical legacy of colonialism by honoring and paying respect to the land, which was taken by conquest along with the domination of the people who inhabited the land and the imposition of white supremacy. We do it to raise greater public consciousness of Native sovereignty and cultural rights as a small step toward equitable relationship and reparation. We encourage the participants on today's call to privately acknowledge the land that sustains and supports you. If you do not already know your area's history, we have provided a link in the chat to learn more about the Indigenous peoples that live or lived in your area. Okay. If you are new to Hunger Free America, HFA national nonprofit building the movement to policies and programs needed to end domestic hunger and ensure that all Americans have sufficient access to nutritious food. We do this through both our direct service and advocacy work, both of these which we feel strengthen each other. As an AmeriCorps Vista leader, my work centers around supporting our Vista members that are working to fight hunger in their communities at different organizations around the country. HFA's work to end hunger is more pressing than ever. According to a report published by HFA in July 2020, the United States is facing the gravest hunger hunger crisis in modern times, with more than 1 in 3 children missing meals or suffering from reduced portion sizes because their families don't have enough money for food. The rate of child hunger is 5 times higher than that before the pandemic, and adult hunger is 2.5 times higher. As domestic hunger increases, all types of low income families are suffering, but data shows that people of color are impacted at higher rates. HFA data shows that in the spring and summer of this year, 41.1% of Black respondent households experienced food insecurity, as did 36.9% of Hispanic respondent households, in contrast to 23.2% of white respondent households. As a global pandemic and demands for racial justice collide, it is more important than ever to uplift MLK's message of justice. For over 2 decades, Hunger Free America has honored Dr. Martin Luther King Jr.'s legacy by coordinating service events and volunteer action supporting long-term solutions to hunger. With this year's Serve-a-Thon, our hope is that volunteers will learn something new, take action in the fight against hunger, as well as take away some ideas on how to continue working towards and supporting a more equitable community. All right. So as we begin this workshop, I'd like to introduce some group norms to frame our dialogue. A safe space is a brave space. We are called to create a brave space where we accept the likelihood that we will be uncomfortable when investigating issues of race, privilege, and oppression, and our roles within them. Work to recognize your privileges. Use this space to recognize and investigate your privileges. For example, class, gender, sexual orientation, ability. Honor the different experiences we all bring to this space. Take risks. Lean into discomfort. We are all in process. Challenge yourself to contribute even if it is not perfectly formulated. Actively listen. Use your energy to listen to what is said before thinking about how to respond. Notice when defense and denial arise. If anyone has additional norms to add, we welcome them in the chat. Okay. So I'd like to introduce our co-host, Tammy Johnson. Tammy is the CEO of Empowering the Masses, community health work instructor, and a medical professional with more than 20 years of experience with working with communities largely affected by health inequity. Tammy, if you want to take the floor.
Good afternoon, everyone. Thank you for joining the workshop today. We hope that something will be said, you will learn or hear something that's new information to you. You will feel empowered beyond the event today to go and affect change in your community surrounding health equity, health inequality, the crisis of people needing food in your community. Empowering the Masses was formed about 3 years ago out of my personal experience with hunger, my personal experience with somebody reaching out to me as a youth at the time that was an underserved individual, and somebody who wanted to break down barriers and provide services to people in our community. And so we feel like knowledge is power. And the more that we can equip individuals with knowledge, the more we can strengthen our communities, the more we can affect change. And so we're excited about this workshop today. And again, I hope that you walk away with some information, you feel empowered to go and serve your communities. Okay. Brianne, you want me to go ahead and share my screen, right?
Yeah, go ahead.
Alrighty, so I'm going to go ahead and share my screen and we're going to kind of go through the slides. Now, mind you, I may not be able to see you on the screen as I'm kind of going through my PowerPoint, And so, of course, if you have any questions, I believe Brianne and Yarna will be kind of looking in the chat box, and then they'll let me know, okay? But I'm excited to get started. So let's get started. Okay, can everybody see my screen? All righty, so today we're going to talk about health equity and how you, as community workers and people who are a part of a vast amount of people in your community, can affect change. But of course, in order to affect change, you have to have the knowledge about the change that needs to happen. And of course, some of the things that are going on that you may not have been familiar with or maybe didn't understand. Okay. I'm going to skip past, myself because they've already done an awesome introduction and about empowering the masses. I want to get right into the information today. Okay. So here are my objectives with this presentation. I am hoping that by the end of the presentation that all the participants who participated today will be able to understand and describe the social determinants of health to their family members, to the community that they seek to serve, that you can go out and you can educate individuals about the social determinants of health. I want you to understand how structural and environmental factors contribute to health inequity. I want you to be able also to describe the correlation between health inequity and poor health outcomes in your communities. Understand ways to achieve health equity and create positive change. And then that's supposed to be understand your role as a community, a person of the community, and working towards achieving health equity. So we're going to go and do an overview of the social determinants of health. Again, these are things that affect the health of the individuals in any given community. And we have to get down to what it is and what the basics are. But before we get into that, I want to give you a definition. Health. Okay. This is the definition of health that I found on the World Health Organization's website. Okay. Health is a state of complete physical and social mental well-being, and not merely the absence of disease. So a lot of people sometimes hear the word health and they assume that if there are no physical ailments, if there's like no diabetes or high blood pressure or things of that nature, then I'm healthy. But we have to think about health from a holistic perspective. My mental health can affect my physical health, because if I'm in a place of anxiety or depression or I'm lacking something, it's going to affect my ability or my want to get up and move around. If I don't get up and move around, if I don't exercise, it's going to affect my overall health. And so we want to talk about that, and we want to understand, what is health, and then what is public health. Okay. Public health is what we as a society do collectively to assure that the conditions in which all people can be healthy. And so that is the premise of the presentation today. What can you do to make sure that everybody that you serve, that you see, that you coexist with, has the opportunity to be healthy? There are so many factors that affect our health, social determinants, and things of that nature. Now, a lot of the times, people think that your health is based on your genetics or biology. My grandmother had high blood pressure. My great grandmother had high blood pressure. My mother had high blood pressure. So it's going to be an assumption that I'm going to have high blood pressure. But of course, people perish when they don't have the knowledge of how to affect change and how to get rid of those generational curses and those generational barriers. And they don't understand all of the pieces of the puzzle, right? So most of us think that it's our genetics and biology. Yes, that's a piece of the puzzle, but it's only about 10% of the piece of the pie. Okay. Then we have our physical environment, our access to health, like clinical care and doctors and things of that nature, our health behaviors. I learned, as a medical professional and as someone who sees people in my community, that it's not, again, just genetics. It could be health behaviors. If my grandmother had high blood pressure, but she was eating a certain type of diet all of the time, and then my great grandmother had the same type of health issues, they were all eating the same type of diet. And now my mother had the same type of health issues. It's because she was eating the same type of diet, because nobody educated them on, you can change your health just by the things that you put into your body and the things that you seek out. Okay. And then there's those social economic factors, the inability to change my diet because I can't afford it. The reason that Empowering the Masses has a food pantry in the neighborhood that we have a food pantry in is because it's what we call or consider a food desert. Most of the individuals in that particular community are limited in their income, and they can only go to their local uh, um, corner store. And most of those foods are prepackaged and full of sodium. And so they feel that that's all they can eat, at the time. And they eat that, they ingest that, and then in turn, we have a lot of health problems, right? I found this very, very interesting as a healthcare provider when I worked in Dallas for two different hospitals that were less than 5 miles apart from each other. We have our county hospital, Parkland, and we have a private hospital, UT Southwestern. And I worked in a geriatric clinic, and we had the Parkland patients, which were more of the county patients. It was a big, vast difference between those patients and the patients that are in geriatrics at UT Southwestern. My patients at Parkland, where we did household visits to, were sick. I mean, so sick at such young ages, between 50 and 60, 50 to 70 years old. And they had so many health ailments. And a lot of it was a direct factor of the health inequity and of the lack of education about how to take care of themselves and their access to quality health care. And then I turned and went and worked at the other hospital, UT Southwestern. Again, these hospitals are less than 5 miles apart from each other. And there was a big difference in what people had access to. The 50 to 70-year-olds at UT Southwestern looked in their 40s, in their 50s. But of course, there was a big economic gap. And I felt that that is something that we need to educate the community on, this huge disparity, less than 5 miles apart from each other. All of it, to me, had more to do with the social economic factors than these things over here. If we can rectify the social economic factors, we can close the gap of health disparity. We can close the gap of people and people understanding what it takes to rectify public health and make people live longer and have better lives, right? Lives of quality and not quantity. Now, here's some of the social determinants of health. Okay. Again, there's general, socioeconomic, cultural, and environmental conditions. Access to certain types of food, and then food that is being produced in certain types of communities. Education, people being educated about the type of foods that they're putting into their bodies. We we do a lot of intersectional work trying to close that gap and that disparity. So much so that we go out and we teach seniors as a part of a program with Baylor Scott and White Hospital. We have some seniors who are on fixed incomes. And sometimes they apply for SNAP benefits and they only get $16 to $17 a month in SNAP benefits. So a lot of them feel like, I'm not going to apply for that. That's not a lot of money. It's not going to affect a lot of change in my household. So what we do, especially prior to COVID, was go out to a lot of the senior living facilities and a lot of the communities like South Dallas or East Dallas or Dixon Circle, those places where people don't have a lot of people coming out and giving them a lot of education. And what we would do is take $16 before we went to the organization or to the community center, and we would purchase $16 worth of either frozen vegetables or fresh fruits and vegetables. And then we would go out into that community and we would show them this is what you can purchase with 16 or $17. So it's worth, you getting those SNAP benefits to bring some fresh fruits and vegetables into your home. With that, our goal with that is to do what? Educate and let them know, hey, you can, have access to certain types of healthy food. You don't have to use those SNAP benefits, to go to the local store and purchase a cup of soup and canned foods that are high in sodium. No, we want to educate you so that you can understand what the determinants of your health will be, right? Even work environments, living and working conditions. Unemployment is a huge factor as it relates to health. Water and sanitation. And we're going to talk about environmental issues that as we get into the slides a little bit deeper. Okay. People's access to healthcare services, and then the issues with certain housing for certain individuals. Okay. Um, any questions for me so far? And I don't see any, I can't see the chat, so I don't see anything.
Tanya, can you put the slideshow for your slides so we can see it better?
Okay.
I have a question.
Uh-huh.
I don't know if I can hear it. You were saying about family and genetics and stuff. If has it ever been shown, like, if you don't know your family history medical wise, you might not ever get, like, you won't see, like, have that bias. Like, for example, I didn't know my maternal extended family for a long time until recently, and apparently there's like diabetes and stuff like that, and like I never had that because I just didn't grow up how they did.
Right. And that's that genetics, right? That's that passing things down from generation to generation. But people have to understand diabetes comes in two different forms. There's type 1, there's type 2. Type 1 is diabetes that you were born with. And then type 2 is onset for you as an adult. And people don't understand the disparity in those different types of diabetes. So diabetes, that type 1, you were born with it, and sometimes it's probably something that you're going to be living with for the remainder of your life, either because your pancreas is overproducing insulin or underproducing insulin. Each person is going to be different. And then of course you have those individuals who have type 2 diabetes that are onset as they become adults. And the doctors will tell you that we can manage this diabetes with diet and exercise. But first, you have to get access to the physicians to give you that information, to give you that education. You have to be able to have these types of educational spaces in the community for individuals who don't have access to um, a primary care physician. And so that's why we're so interested in empowering the masses with training and certifying and getting community health workers out there to go out and disseminate this information to the community, teaching people about diabetes and their history. And if I don't know my history, maybe because I was adopted, or maybe because I didn't grow up with my maternal family, but tell me what this disease is and how I can either manage my disease better or prevent myself from getting this disease. That's where that health equity comes in, disseminating and producing and putting out the information equally to all communities, not just communities who are in a bigger and a better socioeconomic status, but those people who are at those lower economic statuses as well. They deserve to have the same information and deserve to have the access to the same type of information so that we can have health equity. Health problems it should not just be one socioeconomic uh, group of people's problems. It should be something that we try to cover together as a community collectively, because if I'm not healthy, then it's going to affect the community in some form or fashion. Right. And so that's why community health workers come into play. And then individuals who want to educate the community, that's how you come into play. You can educate your community if we give you the information and we give you access to the information. And then you can go out and you can train your fellow coworkers and your fellow community. And then we can try to close the gap of health inequity. But my people perish for lack of knowledge because we don't know how to manage diseases. We don't know how diseases from my grandmother or my mother or my maternal side of the family or my paternal side of the family can affect me, or how I can change it just by changing the way I eat. Right. And so and I want to get a little bit more into that. Right. Okay. So I put here, and it's kind of hard for me to see a little bit. Give me a second with all the stuff across the screen. All right, so I put, what are the reasons behind the glaring racial disparities? Many people of color live with underlying yet substantially avoidable chronic health conditions such as diabetes, heart disease, obesity, and asthma. People of color are more likely to be uninsured or underinsured, restricting access to health services. Many work in service industries and have lost their jobs and accompanying health insurance. A study in 2017 showed that 10% of minorities in America, 10.6% of minorities of the average, 10.6 minorities in America did not have health insurance. So if I don't have health insurance, what's going to happen? I'm going to be afraid to go to the emergency room if I have an illness. I'm going to be afraid to go to the emergency room to get my medications filled because I'm going to be afraid of that bill. But that's 10.6% of the population versus non-people of color. There was only 5.9% in 2017 that didn't have health insurance. That's a big old gap, right? When we health insurance and access to healthcare should be a right for everybody, right? It says people of color make up a large part of the country's essential workforce on the front lines in every community across the country, serving in grocery stores, delivering packages, driving buses, ensuring people can stay home right now in the midst of this pandemic. But a lot of these workers have lost their jobs, and a lot of them now don't have health insurance. So that makes a big health inequity. Essential workers often rely on public transportation to get to work, and putting them at increased risk of exposure and an ability to control social distancing. Many live in multiple generational settings, presenting additional challenges to their health and safety during this pandemic. Remember, in the beginning, when all of these things were happening and we were starting to have certain different types of populations and generations of people who were affected, it was because there was a lack of education being presented about how things are passed on, how things are spread. Again, because there was no education. So there's lack of equity, lack of people having knowledge about what health is, right? So how do we define it? We can define it, then we can help rectify it. Health equity, inequity. It says attainment of the highest level of health possible for all people. Achieving health equity requires valuing everyone with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health disparities and healthcare disparities. I mentioned before that I worked for two different hospitals that were less than 5 miles apart. And there was, for me, my own first hand experience in the lack of disparities, in the lack of equality in the healthcare that was provided. Not because the providers didn't want to do it, it's because they didn't have the access to the same thing that other hospitals had access to. They could only do what they could do with what they had. And unfortunately, it wasn't enough to disseminate and to give out to everybody that they were trying to serve. So we would have a lot of individuals who had these ongoing health issues, but didn't have transportation, didn't have the knowledge about the services that were being offered to them. And of course, the hospital didn't have the resources to get this information out there to these individuals. So we have individuals who need the information, and we have individuals who have the information to give out. But then there's a problem. We don't have all of the tools required to get that information out there to individuals. If we can teach people how to manage their health right at the community level, then we can close that gap and we can close that health equity gap. And so when we teach individuals this type of information, either again, if you're trying to become a community health worker or you just want to be somebody in your community that can help bridge the gap of health inequity, when we can teach and empower the community to empower their own communities, then we can close the gap, right? And we can stop the health inequities. But before we can do that, we have to get rid of some of these things here. One of the first things that we want to get rid of is structural racism, okay? Structural racism is a normalization of an array of dynamics, historical, cultural, institutional, and impersonal, that routinely advantage white people while producing cumulative and chronic adverse outcomes for people of color and American Indians. And again, it's not something that just happened. And structural racism has happened over years and years and years and years until it has become a normality. And we think it's something that's normal, right? So that can be from lack of access to healthcare. It could be redlining certain districts and certain, communities. It could be certain businesses not wanting to come in certain underserved communities or certain areas. And so people don't have access to certain things. Okay. And then we have structural inequalities, structures of or systems of society such as finance, housing, transportation, educational, education, social opportunities that are structured in such a way that they benefit one population unfairly, whether intended or not. And I mentioned that earlier, right? That if I don't have access to a job, if I don't have access to the right type of education, then I can't get a job that's going to give me better housing. I'm not can't get a job that's going to provide reliable transportation. So if I don't have these things, I'm kind of stuck in a space to where I'm only privy to what's around me and what's available to me. So we have to close that gap. We have to change our communities. We have to spread out the wealth. We have to spread out the knowledge. We have to spread out the access to individuals in communities who don't normally have access to these things. Now, this is how it works. If I have great education, then I have access to great employment. Then the better employment that I have more financial security. When I have more financial security, I can live in a better neighborhood. I can pay property taxes, right, in that neighborhood. And when I have better property taxes and I can pay more property taxes, then I have access to quality systems. But unfortunately, the structural piece here that education is not equal in every place, in every community, and in every city. So with education not being equal everywhere, then that lack in the access to quality employment is not going to be equal. Then of course it's going to trickle down again to the lack of financial security. So there, I don't have a good job. I can't find a good place to live. I can't live in those better areas that's going to use those taxes that I'm paying to put into my school system. And then it becomes a never ending cycle, right? A never ending cycle. Lower education is going to lead to what? Unemployment, financial insecurity. Again, the inability to pay certain type of taxes that's going to affect the school systems in my area. And then again, we just keep running this cycle. And that's because of structural inequity. Structural inequity, and then these things, I don't have access to the right type of employment. I don't have financial security. I can't buy food that's going to make me healthy. I can't give that information to my family or my children. So the cycle is just going to keep continuing to cycle on and on and on because it's been happening for so long that we feel like we can't break the cycle because we don't have the ways and we don't have the tools, we don't have the knowledge to break the cycle. I'm gonna skip past a couple of these. Okay. And who's affected by these structural inequities? Okay, and I just put just different people up here, but it's going to be different because we're in a 50 states, right? And people from all across the country. So it may be different and it may affect different types of people in different areas. But this is for me in Texas, right? Coming from Dallas, Texas. You know, we have rural Texans, we have African Americans and children, persons with mental health challenges. And we talked about the lack of access to health earlier. In 2018, in 2018, only 8.7 African Americans are people of color, not just African Americans, but people of color. Only 8.7% of the population had access to mental health. 8.7% compared to non-Hispanic, non-minority access to mental health. That's a huge disparity. That's a huge structural inequity. And then we have things like our environment that affect us. Okay. Why do we need environmental equity? Okay. Because environmental racism is a problem too. It's an issue. It disproportionately affects different people of color, lower socioeconomic people in neighborhoods. We have more landfills. We have more buildings that have crumbling infrastructures that maybe have lead. They may be not safe for people to live in those lower socioeconomic areas, but nobody's coming in and wanting to change that. So if we have that, the property taxes are going to be low. The education system is not going to be well. There's going to be an issue across the board because of the environmental inequity. But people don't understand it. They just feel like this is just where I live. I live in this neighborhood, and then I just have to move to a better neighborhood. not understanding that, hey, I can combat environmental racism. I can combat environmental inequity. And if I do that because now I'm equipped with the knowledge, then I can change this area that we love. We live here, but we don't know how we can change it because nobody's coming in and giving me the education and letting me know what that means, what environmental inequity means, and how it's going to affect my health, how it's going to affect my education, and how is it going to affect the people around me and my neighbors. Okay. And then some other things that can lead to health inequities is immigration status. Um, it says immigrants are much less likely to have health insurance, and a lot of the times are less likely to seek out help for any health issues that they're having. So they will try to self-medicate. They would try to do a lot of over-the-counter medicating of themselves to try to treat their illnesses because they don't have health insurance. Women, it says while women have a higher expectancy than men do in most nations, they experience higher rates of domestic violence, resulting in trauma, depression, and other chronic health conditions. Not in those areas that have a lot of socioeconomic power, not in those areas that are not economically challenged, but more so in those areas of a lower socioeconomic environment. And again, because they're not given access to the things that they need. Now, how could the education affect their health? How can education affect one's health? But before I go to the next slide, I kind of want to stop here and then ask if there are any questions about anything that I've said so far.
I was just curious what the second half of the statistic was. It cut out on the audio for non-Hispanic individuals. What was the gap there?
Or which one, for mental health or for uninsured?
I believe it was mental health.
Okay, so for mental health, 8.7 non-Hispanic, who had health insurance and who had access to mental health, it was 19.6% of the non-Hispanic, non-African American population. They had access to mental health services, right? Compared to the Hispanic and African American individuals, that was at 8.7%. 8.7%. That's a huge disparity. That's a huge disparity, and that's huge health inequity, right? Because everybody needs help.
Okay.
Go ahead. Somebody has something.
No, I didn't mean to interrupt you. I had my comment or question is actually different. So if you're not finished, then go ahead. Oh, I just wanted to. I wanted to ask if and maybe this is something that you're going to go into later. One of the things that is also very prevalent, which I personally have experienced, is even having access to good health care, having a good job, living in a nice area, being treated differently as a person of color, which makes you not, you're less likely to even want to go to the doctor. It's my understanding that a lot of healthcare providers hopefully are becoming more educated about that because that's prevalent and as you mentioned, growing up in America, and it didn't escape the healthcare industry. So I didn't know if that was something you were going to talk about at all.
Well, it didn't escape the healthcare industry. It didn't escape the education industry. And I say a lot of these things, and this is a passion of mine, and I like to talk about these things, and I like to teach these things because I've experienced a lot of these things, if that makes sense. Now, my sisters and I were those kids who had to wait to go to school to eat because we were, from a lower socioeconomic background. So we didn't always have access to food. But the thing is, my mom was on public housing and she was on public assistance and things of that nature. And so we lived, in my early years, we lived in what we call the projects here in Dallas. But then my mom, of course, got a housing voucher because they were trying to change how things were redlined. And so she got a housing voucher and we were able to move to a predominantly non-African American area, if that makes sense. And so my sisters and I went to a more, we were like the minority big time. Like there was only maybe 5 African Americans in the schools that we went to, as kids. We were still hungry. We were in what we consider better schools, because of my mother's housing voucher. But the way we were treated, and the access to certain things and the certain information that was given to us, was apparent that it was a big difference, from our counterparts and from our classmates. And then when we went to the doctor, we were treated differently. We were asked certain types of questions, and we were treated a certain type of way. And I watched my mother firsthand. She passed away about 10 years ago, but I watched my mother firsthand. She passed away when she was 48 years old, which to me was a premature death, right? But because of her ethnicity, I can see that people didn't take her seriously when she went in, and she said, I'm having this ailment, I'm having this issue, I'm having these symptoms. And people would tell her, and the physician would tell her, oh, it's just because of this, or it's just because of that. Never did they run any further testing. Never did they say it could be this. Never did they say it could be, X, Y, and Z. They just told her that it's nothing to worry about. And then by the time I was an adult, of course, these symptoms had been living and been with her for so long. But then I became an adult. I became a healthcare provider. And so I now had the inside knowledge, right? I had the education to say, Mom, I think this is what's going on with you. But mind you, she had been dealing with this for about 10 to 15 years. So by the time her daughter was grown and old enough to educate her on what the issues were, it was too late. You know, that you had lupus, Mom, and they didn't treat you because of your lupus. And so you didn't have access to the medication. You didn't have access to the doctors. Nobody sent you to see somebody about your autoimmune health. Nobody sent you to see, an internal medicine doctor that specialized in these types of things for you, because nobody took you seriously and nobody gave you the information that you needed. But unfortunately, it took her daughter becoming an adult. But again, it was too late at that point, if that makes sense. And now, as a person who can provide, and a person who has access to information, a person who has access to the healthcare system, and who knows how the healthcare system works, it does not change because of the structural piece of it, if that makes sense. I'm a mom of 6 children, and my fifth and sixth child, are 11 and 12. But my 12-year-old, before I gave birth to that 12-year-old, I was pregnant about 6 months along, and we lost that baby. And so we had to go in. I had to have the surgery, and then of course we were expecting again, with my daughter, months later, the one that I have now. And if it wasn't for the physician that I had, who chose to break down the barriers of inequity, and I started to have the same symptoms with my 12-year-old. I started to spot, I was bleeding, I was having the same issues. And he was like, you know what? The insurance company and this group of people say that we have to let you go through 3 miscarriages or 3 lost pregnancies before we can run these tests on you. But that particular physician was like, we're not going to do that. We're going to go ahead and run these tests on you, because I want them to tell their daughters, and I want them to tell their wives that they need to lose 3 babies or lose 3 pregnancies before they choose to run these tests. But what if I didn't have a doctor who was interested or trying to change the inequity or the lack of access to healthcare? I would have lost the 12-year-old, and I would have had to lose 3 or 4 pregnancies because of my ethnicity, before they figured out, hey, you need to take this medication, you need to be on bed rest, this is what you need to do for the remainder of your pregnancies. But only because I was a healthcare provider. You know what I mean? And I had the inside knowledge. It is to why my 12-year-old exists right now. And again, only because I had the information. And so when I say, how could education affect one's health? My people perish for lack of knowledge. If you don't know what questions to ask, if you don't know what your rights are, if you don't know where to go or what information, then of course you're going to be in that despairing population, right? And you're going to assume, well, this is just what happens and this is just what people do. But that's why it's important for people who want to change their community, for your ethnicity, for ethnicities that are not yours. It's important for you to become educated, and then for you to go out into the community and affect change. You don't have to have a PhD. You don't have to have a master's degree behind your name. You can serve in any capacity as long as you get the knowledge and then you change it. And that's how we can affect change. And that's how we can rectify health inequities, because we can disseminate that education and that information down to our communities, if that makes sense. And so that, and I may be talking a little, but I'm really passionate about it because, again, I've been in the medical field for over 20 years. And so I've seen a lot of people who a lot of things that just didn't sit right with me, if it makes sense. When I work with people who had money and I work with people who had no money. And there's a big difference in how people are treated because they don't have the information, or if they have the information, if that makes sense. So it's important to me that everybody understands. Please ask questions. Please learn as much as you can so that you can change, your neighborhood. If you can affect change with 3 people, then you've done your job. Okay. Well, let's talk about health equity and poor outcomes. Health inequity, differences in health statuses between more and less socially and economically advantaged groups caused by systemic differences in social conditions and processes that effectively determine health. Health inequities are avoidable. They are unjust and therefore they're actionable. What does that mean? They're avoidable, meaning if we give out information, if we educate people, if we teach people what they have the rights for and what they should have access to, and again, what questions that they're supposed to ask, then we can change the unjust process and we can change the unjust system. It's actionable. We can change it when we equip ourselves with the right knowledge. Um, I was teaching a community health worker class the other day, and I was explaining to my students about something as simple as the Patient's Bill of Rights. A lot of patients don't know that there's a such thing called the Patient's Bill of Rights. You know, how many of you knew there's something called the Patient's Bill of Rights? No, there's something called the Patient's Bill of Rights, meaning when you go to a hospital and you are in an emergent situation, under that Patient's Bill of Rights, people can't turn you away. They have to stabilize you. Now, if you don't have health insurance and things of that nature, they're limited to how much they can do because, of course, the hospital has to make money in order for it to sustain itself. But you have the right to be seen. You have the right to be stabilized. And then, of course, you have the right to be transferred to a hospital that, either can offer services to you from with public health, or services to you that you can afford. But a lot of people don't even know that that's something that's out there. Why do I know it? Because I'm a healthcare person, right? But the average person doesn't know that there's something called the Patient's Bill of Rights. And of course, it's different in each state. I only know what's, effective in Texas. But, I would urge you to go out and look in your state and see if there's something called the Patient's Bill of Rights in your state. I know that there is one in Texas. Um, let's talk about, we're going to just look at diabetes real quickly here and look at the social economic um, population and about how much money people make, and then how many people, what percentages of those people have diabetes. And you can see that there's a huge disparity here. And this is just Dallas, right? Let's start here. Let's go over here. If I make $50,000 or more, right now, the percentage of people who have diabetes in this category are about 4.4. And I'm talking about type 2 diabetes, right? The lower my income goes, the higher incidence of people with being diagnosed with diabetes. Why do you think that is? Lack of access to healthcare, health inequity, health inequalities, lack of education, lack of knowledge about how I'm supposed to eat, and how I'm supposed to manage the diabetes because of the amount of income. Remember, I asked you earlier, can my income affect my health? Yes, it can, because I don't have the money to pay for things. I don't have the money to eat healthy, or I don't have the information that even if I do have a low income, how to utilize my money in the best way to eat the best to manage my health. But that's alarming to me, that the lower amount of money I make, the possibility of me having this disease that can be prevented is increased, which is crazy. Okay. Now, If I don't have access to the money, if I can't buy the foods that I need, if I can't manage my health, if I can't manage my weight, what does it lead to? It leads to me having all of these comorbidities, all of these diseases that could have been avoided had I had access to right healthcare, had I had more money, had somebody been able to come into my community and teach me, had somebody put a leaflet on my door that I can read that can tell me, hey, this is how you can manage this disease. This is how you can eat better. You know, it leads to coronary heart disease, high blood pressure, stroke, type 2 diabetes, abnormal body fat, okay? And so many more things. I heard somebody unmute themselves. Anybody have a question or a comment? Because I can't see you guys.
Hi. My mom was a home health nurse, and she worked in higher income areas and lower income areas, and she would often refer patients to things like WebMD and for them to find out more information about their health in general or whatever their specific incident was. So I was wondering, how much lack of not having the internet would affect people's health and getting that type of education to that population that needs it. How much do you think that affects?
That affects it a lot, but what we don't want is a lot of internet doctors either, right? Because we don't want a lot of people going to WebMD and saying, I have a cough and an itch on the right side, on the back left of my back. And then I go type in those symptoms and then it tells me I'm dying. Doesn't make sense. So we don't want a lot of internet physicians, but what we want is access and education and people coaching people along and people who have the actual knowledge. And can teach me exactly how to deal with this ailment and how I can combat this ailment by exercise, by eating properly, by changing my diet, by walking 30 minutes a day. It's like type 2 diabetes, and again, it's going to be different. Don't take my word for it. And of course, if you have these issues, make sure you consult your physician. But even your type 2 diabetes, how your doctor will tell you, if you can just lose 10 to 15 pounds, we could change the amount of medication you're on. We can manage this thing with diet and exercise, and get under the physician's care. And then, talk to your physician and ask those questions. So we can get that information out there to the population and to the community to say, hey, did you ever ask your doctor, can I combat this disease with diet and exercise? Or are you going to a clinic who's only just giving you medication and not trying to teach you how to manage this disease, or are trying to teach you how to overcome this disease? Hypertension. Are they telling you that longevity or being on these hypertensive medications for a long period of time may have other illnesses? But how can we change it? If I just change my body weight, or if I lose weight, how can I manage my diseases, and how can I manage my health a lot better? And how can I change my family outcome? You're not a sum total of your genetics. Again, a lot of it sometimes is because you just don't have the information. So if my sister has been eating fried chicken, and my grandmother had been eating fried chicken and green beans and greens and all that good old cornbread, that we eat here in Texas, but then I decide that I'm a vegan or a vegetarian, and I'm choosing to eat leaner meats like turkey, and I'm eating more greens, and I'm having, a colorful plate. And I noticed that, and now I'm 40, and I remember my grandmother got diagnosed with diabetes at 40, and my mother got diagnosed with diabetes at 40. But then I eat differently, and I walk at least 30 minutes a day. And now I'm 40, and I still haven't been diagnosed with type 2 diabetes. It's a change because somebody told me, walk, exercise, eat, change, the things that you eat, and then you can change your genetics. Everybody doesn't have to die from the same illnesses if we can give people the right education, and we can close that gap to health and equity. Okay. And I want everybody to think about this, and I want everybody to know this. If we are not all healthy together, none of us will be as healthy as we can be. or as we could be. Just because, if you're healthy, teach me how to be healthy. Help me close the gap of this health inequity. Help me close the gap of this inequality. Again, knowledge and education and teaching and advocating. These things are actionable. These things are, they can be changed if we have enough advocate, if we have enough boots on the ground. And I'm not telling you again that you don't have to have, all of these initials behind your name. You just have to be willing to seek out the information and seek out the knowledge and go and teach your community and go and present the information to your community because you've gotten the information from a trusted source and you've gone and you've got the training that you needed. And now you can each one reach one is how I believe it. Each one reach one. Each one teach one. You learn to live better. You learn to do better. You can change the gap. You can close that inequality. You can make your community better because you've learned, and I'm going to give you the same information. This is a community effort. Health and health equity are created in the community by people working together to create just economic, social, and environmental conditions to promote health. We have to work together. We have to go and get the information. And again, we have to bring the information back to those communities that look like us and that don't look like us, but that don't have access to the information on their own. We have to be willing to go and provide the information. We have to be willing to be advocates. We have to be willing to change the spectrum, right? Public health is what we as a society do collectively to assure the conditions in which all people can be healthy, not just my family, but everybody's family. I want to give the information out there to everybody. For and I think this is kind of funny. Those of you that have children, how many of your children like to eat things like Takis? Those hot chips. Okay. But for me telling you as a healthcare provider that is so not healthy for your child, that little red stuff on there, a lot of kids are in the ER with acid reflux. A lot of kids are in the ER because they're having some stomach issues, some digestive issues. But guess what? We just keep feeding it to them. Oh, it's just something that the kids like. I ate hot chips when I was a little kid, but not realizing it's affecting them. Right? So if I learn something, I'm going to go back and tell my sister who has children. She's going to tell somebody else. They're going to tell somebody else. And we're working collectively as a community, right? To change what we see around us. I can't see the top of my screen here. Sorry. All right. So everyone can change and everyone can be an advocate. We can make sure everybody has access to economic and educational opportunities. People graduate high school. People have access to jobs. People have access to transportation to get to and from their doctor's appointments. The capacity to make decisions and affect change for ourselves and our families and our communities. We can empower people who are typically and historically underserved and undereducated. We can talk to people about opportunities for civic participation. You don't have to, and this is Dr. Martin Luther King's day, right? What did he say? You don't have to have a degree to serve. You don't have to have a master's degree. You just have to have a willingness. I'm totally butchering his quote, right? But he tells you, you just have to be willing. You don't have to make your subject and verb agree to serve and to change and to affect change and to make your communities better. You just have to have a willingness to do it. I'm gonna find the quote because I know I just butchered it. So bear with me 1 second here. So this is what he said. He said, everyone can be great because anybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and verb agree to serve. You just have to have a willingness to do it. You have to have a willingness to educate yourself, educate your family, educate your community, and then we can affect change. We can close the gap of health inequality. We can close the gap of social and systemic racism and environmental racism and all of those things that make everything compounded and to make it worse. We just have to have the willingness to go in and disseminate the information. Everyone needs and deserves social and environmental safety in the places where they live, where they work, where they worship. They deserve to have, proper housing conditions, low crime rates, great schools, social norms and attitudes of safety and health. They deserve to have culturally competent and appropriate services when the need arises. Everybody has the right to have access to healthcare, mental health care, and financial assistance. Everybody has that right. And in order for everybody to have access to the basic rights that they're supposed to have, we have to be willing to educate ourselves and then educate our communities to do it. How can you change? How can you help? How can you address health equity in the communities where you live and work? Be an agent of change. This is what you can do. You can understand what creates health and conditions necessary for optimal health in the neighborhoods that you live in. Or if you live in a great area and you have access to these things and now you have the knowledge, go and serve in a community or in an area, an educated community or an area that don't have the same access that you have. You can be that agent of change. You can create an agenda, decide on what you can work on and work you can do to address the issues that you see plaguing communities around you, and then find out how you can go about and do it based on the areas that you live in. Then, of course, I said it 55 times, right? Be an advocate, okay, on behalf of individuals and communities, and hold policies and protocols accountable. So, because we have, and why do I say that? Because there's always policies and protocols and procedures put into place, but are people holding the people who put these policies and procedures in place accountable to making sure that we said that we're going to do this for this group of people? Is it actually happening? If not, you be an advocate to make sure that these things are happening and people are following through what they say they're going to follow through with, so that everybody can have access to healthcare. If we're all healthy, what better world could this be, right? If we all have access to mental health care, if we all have access to basic nutrition and needs and food, if we all have access to proper education, what amazing place that we can have. What an amazing world. What an amazing country we can have if we all had access and there was no inequalities and there was equity for everybody. But it can happen if we have more agents on the ground. It can happen if we have more people who understand. It can happen if we have more people who want to create an agenda and change the environment around them. It can happen if we have more advocates for communities that are underserved. All of these things are actionable. All of these things can happen if we choose to seek out, areas and ways we can serve and we can change.
Oh,
What can you? So I heard. Is there a comment?
yeah, there's a comment. One thing that I was thinking of, like with what I said a little bit in chat, is that each hospital also has something called a charge master. And a charge master is like a book that has the list of prices for, like, let's say you get neck brace because it injures your neck. It might cost $5. However, you got to pay $500 for it. And this is so the hospital can make a profit because of the insurance prices that they charge the hospital. So that's kind of forced them to raise their prices and to stay in business, because a hospital is a business, like we said earlier. So what's really not making it fair for communities that are lower economic is that they set a standard for these hospitals to have a price for like a 500 neck brace for each community. And that's what I feel like is one of the big sources of why healthcare is so expensive, is these insurance companies that's charging hospitals so much.
And
So they
that's
have,
where we go back to that accountability, right? And policies and procedures, and making sure that people are being held accountable
Mhm.
for these types of things. And then that's where you come in. And of course, we don't want to make it unfair for anybody, because I'm telling you, as a healthcare provider, the hospital has to make money, right? It's a business, but it's there for people who are sick and people who need help. But we can help, we can affect change. When they say go vote, when they say there's policies and procedures and things and all those things happening, that's what you're supposed to go out there and do. If you hear, that, hey, this person is proposing this, to change, and I'm an advocate for it, then you go out and you support it. in all of those capacities and ways. If everybody decides that, hey, I want to be an advocate of change and I want to close the health inequities and I want to close these gaps, and I want to change these policies and procedures, then you do so by educating yourself, and you do so by being an advocate, and you do so by putting the information out there, but making sure you have the right information, making sure that you're educated and you have the right information and you're giving out the right information, and not based on personal beliefs and things of that nature. Make sure you have actual research-based information and research-based knowledge. Well, and then you can go out there and you can advocate. Right? It says and I put on here, it says work to support health equity and health in all policies. Build the capacity of our communities to understand and address health equity. How do we do that? We go and we educate ourselves. We take classes. We ask questions of those who have the information. Okay. Develop creative and culturally, linguistically appropriate ways to educate the community, making sure that the people that you're advocating for understand what you're saying. So if it means having things in multiple languages and multiple translations, all of those things, making sure people understand, and then make sure, and when we do community health training, and I tell people, be an advocate for people who look like you or people who don't look like you. Understand the culture, understand that way people communicate, because if you can understand the culture and if you can understand the way people communicate, you can affect change. But you have to be willing to understand and learn, different cultures, right? And how they receive knowledge and how they receive information, so that you can affect change. And then collaborate with others. If you don't know how other cultures are, if you are not familiar with people who don't look like you, collaborate with others who are familiar so that you can learn. Ask questions and communicate. Break down those silos, expand and strengthen partnerships and relationships and develop solutions together. We have to work together collectively. This is not a African American problem. This is not a Caucasian problem. This is not a Hispanic population problem. This is an everybody problem. And I don't know the right term, so I'm hoping I'm not saying the wrong terms when I'm talking about different ethnicities, right? But this is not one problem. This is everybody's problem. We all have to work collectively together. We all have to be willing to communicate. We all have to be willing to understand each other, so that we can bridge the gap of health inequity, so that we can understand, and so that we can make sure people have access to the things they need. Because if other people are healthy, then I'm healthy. Then the economy is healthy, because people can work and people can give back and people can contribute because they have the right knowledge and they know how to take care of themselves and they know how to bridge the gap, only because somebody was willing to strengthen, somebody was willing to be a partner, somebody was willing to build relationships, and somebody was willing to build solutions together to go out and change the areas that don't have health equity, that don't have the information that they need to be better and to have a better, a more systematic issue, a systematic approach together, and a seamless, approach to these issues. All hands on deck, guys. Achieving health equity and eliminating health disparities requires valuing everyone to make intentional, consistent efforts to address avoidable systematic inequalities, historical and contemporary injustice. Learn your history. Learn how these policies and procedures were put into place. Learn why there's a lack of knowledge in certain areas. Learn why there's not access to education in certain areas, because when you know the history, you can change the history. That's my I think I'm out of time. I was timing myself there, Ms. Yarna, to make sure that I was on time, but I think we're up to more questions if we have time for more questions. Are they still there?
Yeah, we are here.
Okay. Well, you're here. I was trying to see if give me a second here. Oh, there she is. Okay. I couldn't.
I don't have a question. I just wanted to thank you. I think there was a lot of very personal stories disclosed to everyone, and there's a lot of people on here. So really brave. There's a lot, obviously, to talk about with this topic. It can be very overwhelming, the injustices within our community. So I just really want to thank you.
No, you're welcome. You're welcome. I hope, it was informative. And you learned a lot, and you're willing to go out and be advocates, and you're willing to go out and learn information and learn other cultures and become and willing to come alongside those individuals that you don't understand, and be their partners and change this health inequity. Because again, if we're all healthy, if I'm healthy, then you're healthy, then we're all healthy. And what a better community and what a better society we can live in if we all have health equity, if we all have access to certain things, if we all have um, the right information. So I'm excited about it, and I'm excited about our presentation today. And I hope you all will enjoy the rest of, what's happening today.
Thank you. Will you be sharing the presentation with us to our emails?
Ms. Yarna?
Yes, so the presentation, the link to the presentation is already on the chat, but I will be posting it again now. So you will be having it. And after the event, I can email all of you with a link to the presentation too. And all the links for this, the final survey that we will be posting at the end of this event, and the donation links. Thank you. Brennan?
Yeah, so I can go ahead and ask a few more questions, or we can get to the service segment. What would you prefer to do, Tammy?
I think we can ask a few more questions, and then we can get to the service segment.
Okay, awesome.
If there are any more questions.
Yeah, if anyone wants to, if you don't want to speak, you can write your question in the chat as well, and I can read it out. Okay, I'll ask one question,
Okay.
if that's all right. So my question is just, what actions can the participants on today's call take to best support your mission?
Best support our mission. Um,
Mm-hmm.
Even though I'm here in Texas, and we're here in Dallas, Texas, our mission is to empower. The name of our organization is what? To empower the masses, right? So how you can support our mission is, even you can do it locally. You can decide, and you can find areas in that are close to you, that are people who need these services, or people who need to understand how to bridge the gap, or how to learn how to manage certain diseases and illnesses, and what they have a right to have access to. And then you go out and you be advocates in your communities. You go out and you participate in these things that are happening in your neighborhoods, and be advocates of change. That's how you can further our mission. That's how you can help us empower the masses. And of course, you can always, share us and share our stories on your social media, and things of that nature. But you be an advocate for where you are, and you find out what makes sense to you, or what maybe in your family members history, or your family history, that you didn't know how to manage, or you didn't understand, and go and learn more information about it, so that you can educate somebody else about it. Because I promise you, if you have questions about illnesses, if you have questions about inequities, if you have questions about so many things, somebody else has the same question. So educate yourself so that you can put the right information out there, the truthful information that can affect change. Because everybody, again, needs access to health equity. Everybody needs to understand what it is. Each one, reach one is our goal. That's how we can empower the masses. That's my goal. Empowering the masses one person at a time. So if each one of you can do the same thing and go out and affect change in your communities, then you just further our mission. We're just a little nonprofit here in Dallas. But if each person can reach one person, then you furthered our mission.
Thank you. Okay, so there is one more question from the chat, from Stacy, that I'll read. So Stacy's question is, do you partner with other nonprofits in the Dallas-Fort Worth area to help move this mission forward? Stacy works for a nonprofit in Denton that works with low-income seniors and feels that it would be very helpful for their clients to hear.
Oh yeah, we can go everywhere now with Zoom. So yeah, if you have seniors that have access to, the internet and you can put it together. I have Zoom for our organization if we want to, get together and talk about maybe doing a presentation for your seniors. Like I said, I work closely with Baylor Scott and White as one of their senior hunger activists, and we do a presentation, and so we can loop them in with that organization. And then again, we can reach more people that way. So yeah, definitely.
So Stacy's follow-up question is, how best can we reach out to you?
You can always, if you go to empoweringthemasses.org and hit and fill out a contact form, then it'll email directly to us, and then we'll follow up with you from the contact form. Empoweringthemasses.org.
Okay, Stacy, that's perfect. Thank you. There's one question I'm seeing. Are there digital brochures available to print documents and create awareness through that way? This is someone from looking to create awareness in Harlem and the Upper East Side of Manhattan with their food pantry.
Awareness of health and equity, or
yes, I would assume so. I think the question is if Empowering the Masses maybe has digital brochures about the topics you discussed today that could be printable to share.
I don't think I have digital brochures, but I think she put the PowerPoint link in. Is that attached, Yarna, to the?
Yes.
Yeah. And so the PowerPoint is in what she sent in the Google Drive. Change it up. I don't mind you using it for your organization or what you need to use it for. And of course, it's going to change based on where you live, and so you take it and you do more research for the areas that you live in to make sure that the information that I presented is appropriate for where you live. But you can use the PowerPoint that I created as a starting point, right? And then you do the research for the areas that you live in, because what I put may not be 100% effective to where you live. So that PowerPoint again is there, and I think it's editable. I did send you the one that you can edit, and so you can edit it and you can use it according to where you live, and add the statistics for the communities that you serve. If that makes sense, if that helps.
There's one other question, just again, how do we contact you? So in the chat, there is listed the website for Empowering the Masses, and just what Tammy said was to fill out a contact sheet through that website.
Yeah, so yeah, of course, again, you can always, and Zoom has given us the opportunity to go wherever we wanted to go. So if you wanted me to do a presentation, for your organization or what have you, empoweringthemasses.org, and say, hey, Ms. Johnson, I saw you on, or Tammy, you can call me Tammy. I saw you on the MLK Hunger Free America workshop, and we would love for you to work with us or do a presentation for our group or whatever. I don't mind at all.
And the editable presentation link is listed again in the chat, just so everybody knows. There's one other question. Again, what's the best way to get in touch with you for any partnership opportunities? This commenter runs a health wellness page on Instagram and would love to be able to set something up with you.
Okay. Empoweringthemasses.org. And the contact form, and it'll come. I see our intake specialist is on here, Ms. Henderson. So she put their office number on there, 972-460-6316. She typed it in the chat. Hi, Ms. Henderson. Yeah. Oh, thank you, Yarna. Yeah, she put more information. There you go. No, yeah, they're
Tammy.
both office numbers are there.
Hello, Tammy. How are you?
Ms. Henderson.
Great presentation today.
you.
How can the community help your capacity building? How can the people that's listening now, how can they help the capacity building of empowering the masses?
Oh, I think right now we're going to get into the service project in just a minute, right? Yeah, so I think Ms. Yarna will open that up in just a minute, our service project. But again, y'all can just share the presentation. You can redo the presentation, make it your own, and then again, reach your own communities with that presentation. And of course, like I said, edit it to make it cohesive and make sense for where you're serving. That's building our capacity, right? That's empowering the masses, one city at a time, right?
Yes, Tammy, if you want to start talking about the service project that you would like volunteers to work on.
Okay, I think Miss Yarna put that in the chat box, but there should have been a link for our service project. And so for our service project, we just ask, I think on there is like a flyer for our food pantry. So if you live in the Dallas area, you can create a new flyer for us. And we kind of gave you a template of the one we use, currently. We don't right now have any zip code restrictions for individuals, at our food pantry. Right now, I think the current flyer that's on there says, what does it say? Disaster relief food pantry. But if you're going to create a new flyer for us and you're good at making flyers, you can take off the disaster relief and you can just put empowering the masses, weekly food pantry, and create a more cohesive flyer. That'd be awesome. That we can reuse and that we can repost, and that we can share. Also, you can um, post on your social media pages about empowering the masses for individuals who maybe want to donate to our organization. Every $1 that they donate helps us provide 3 meals. So $1 can buy 3 meals for our organization, because of our partnerships with different community organizations. And so you can, do it in that capacity. What else did I have on there? Oh, I think one of our stories, we were on the news in a good way on Friday. And so she put that link on there as well. You can share that with your communities on your Instagrams or Facebooks, or what do my children call it? Twitter, you can you can share it on Twitter. I don't have Twitter, but Instagram and Facebook and all of those things. So I think she put the service project guide in the chat. If you click on it, I think again, it has an example of our flyer. Also, it has the things you can tweet or you can post on Instagram about empowering the masses. And then you can send people, of course, to our website. And again, let them know every one, even $1 helps helps further our mission. Because again, $1 buys, it provides 3 meals for our families. And we serve quite a bit of families, in Dallas. Again, we don't have any zip code restrictions.
All right, so we can work for half an hour, and if you want, you can just turn off your camera and turn on your audio, and we'll be gathering together at 4:25 to see maybe you have some other questions before we end this workshop, and just to for the final remarks from Tammy. Okay, sounds good. Thank you. If you have any question during the volunteering service, you can just put it in the chat and I will be monitoring it during this half hour.